think this is the 5th of these I've done this week, and the others I did all by myself. So I've got good backup here today. I can relax a little bit and let them answer the tough questions. But let's talk about where we are in Washington and where we are in this discussion. Obviously, we did not meet the artificial deadline in Washington, and there were good reasons for that. This is a big issue. It's 16 to 18% of the economy. It's a system that works for lots of people. And in fact, I think it was Steve who said something like we've been saying, let's be sure we keep what works and fix what's broken instead of doing the opposite. And it would be possible to do the opposite. About 83% of the American people think that their healthcare system works well for them. Interestingly, one reason this problem is so challenging to deal with is that same 83% think there's a big healthcare crisis somewhere, but it's not for them. So if you got a room with 100 or let's just to make it easy for me to add here, 200 people in it, 186 of them feel pretty good about their health care. Now, 72% of you think it costs a little too much. So you want, more health, you want good quality, lower price, and who doesn't want that? And then we want to get to the folks who are uninsured. What I don't want this debate to turn into in August is the debate that clearly the administration would like to turn it into, which is one side doesn't want to do anything, and so there are really only two alternatives, to do nothing or to do their plan. And there's a lot of alternatives between nothing and their plan. And one of the things that would help the system would get more market forces into the system where people have more choices. I'm not for a system where you would have the same choices you have now or fewer choices than you have now. I'm for a system where you'd have more choices than you'd have now, where you might have the option, for instance, to continue to get your health care at work, but also could say, I found something out there in this bigger marketplace that has now been created that fits my needs better, my family needs better. I want to take the health care, the tax benefit that my employer has solely had up till now and either direct the employer to make the payment for you monthly or just you get to make it yourself. That's one way you expand choice. So you have more options. We had a hearing on the Canadian and the British system, and the British cancer doctor that was in the hearing that I kept saying, he said, we've lost quality in our system because we don't have competition and choice. And the point he was making was competition and choice drive quality. Well, it also, he wasn't thinking this, but I would say competition and choice drive quality and price. The more competition you have, the more choice you have, the better quality you're going to have and the better price you're going to have. Half a dozen years ago when we added prescription drugs to Medicare, and by the way, for the first time, changed the Medicare rules so you could actually be well when you saw a Medicare doctor. The first 40 years of Medicare, you couldn't see nobody saw a doctor under Medicare that wasn't sick. In 2005, January of 2005, for the first time ever, unless it was by accident, you got to see a doctor on your Welcome to Medicare physical. That's the kind of primary care. 65 is pretty early for primary care, but if you've not had it before, that's the time to get your blood pressure, your lipids, all those things, rather than you stagger into a doctor's office at 75 and you're sick and you've got a big problem that could have been easily taken care of at 65. So we did that, we did HSAs, but we also added prescription drugs to Medicare. And when we did that, for the first time ever, the government, instead of operating the system like the government tries to do with Medicare and Medicaid, set the prices, figure out the reimbursement schedules, do all of that, the government decided we would organize a system that had competitive forces in it. Now, the government organized system, which, by the way, the same people that say today there wouldn't be enough competition, so you have to have a government competitor. The government organized system has lots of competitors, and it's 40% cheaper than the lowest estimate anybody made as to what this would cost. Now, still cost a lot, but it's 40% cheaper. It's a system that's 40% cheaper. It's a voluntary system that 90% of everybody who could be in it is in it. 90% of them think it's either good or excellent, and 100% of them know they can change their provider sometime in the next 12 months, and so does their provider. And of course, there you've got suddenly some real market forces at work that have impact on price, quality, and satisfaction. And then the other big debate will be the government competitor. You know, the administration's view and Henry Waxman's view, the chairman of my committee, the speaker's view is that you need a government competitor so that you keep the private competitors' costs down. I frankly just think you need more competitors and more things to compete for, more choices that people have and more places to go to get different kinds of insurance that they think meet their needs better. Because I believe, and a lot of other people do, that the government cannot compete fairly. And if the government becomes one of the competitors, eventually the government is the only competitor. You know, as a Republican, I've got to think of a better example than this, but my example is a government competitor is like an elephant in a room full of mice. Okay, has everybody got that in your mind? Elephant, room full of mice. The smart mice, the fast mice, get out of the room as quick as they can. And that's what would happen. You know, if the government starts competing, the best of these healthcare delivery companies would start figuring out what they're going to do next, and they'd start figuring out as quick as they can. The slow mice get crushed by the elephant, and then before long, the only thing left in the room is the elephant, and then you've got government-run healthcare. Now, if that's what you want, and there are a lot of people who do, I don't think it's a majority in the country, but a lot of people do. If that's what you want, this is a way to get there. And, you know, you and I, no reason to have a debate about whether you're right or if that's what you want, that is one way to get there. Barney Frank was on a news show one day last week and said he'd rather have single-payer system, and he thought the best way to get there, the surest way to get there now, was to have a government competitor, and before you knew it, you'd be at single-payer. Virtually everybody on the committee I serve on both sides believes that within a very short period of time, if you had a government competitor, you'd only have one competitor. So the way I see that, that's really the option with a government competitor is you decide you only want one provider of health care, and that's the government. But I'm for a program that everybody has access to, regardless of pre-existing conditions, that they can afford. And if we would do that, we would solve this problem at a much, much lower cost and not take a system that produces the best health care results in the world and jeopardize that by making that a government-run system. And so I hope this debate doesn't turn into a debate between either do my plan or do nothing, because there are always lots of options between anybody's plan and nothing. So thank you all.